friends, I am Dr. Neeta Gupta, gynecologist practicing in Noida. Today I am going to talk about emergency contraception. It is very important to know about emergency contraception as it prevents you from unwanted pregnancy, thereby saving you from going through a mental trauma of aborting a pregnancy. So what is emergency contraception? Emergency contraception is a contraception which is used when a couple has had an unprotected intercourse or if the regular contraception which they are using has failed. So when can emergency contraceptive be taken? Ideally it should be taken within 3 days of having an unprotected intercourse, but it can be taken up till 5 days. Earlier the better. So if a couple takes, it is more effective if it is taken within 24 to 48 hours. What are the pills available for emergency contraception? There are 2 pills available in the market by the name I-pill, which has a component which has a hormone levonorgestrel in it. It comes in the strengths of 1.5 milligram, so it has to be taken as a single dose. And if you get a strength of 0.75 mg, then 2 tablets has to be taken 12 hours apart. There is a new medicine which is available in the market which can also be used as an emergency contraception by the name ulipristal acetate. It can be taken as a single dose of 30 milligram. So how effective is this emergency contraception? These pills are almost 94 to 96% effective in preventing a pregnancy. So what are the side effects of emergency? As such, these these emergency contraceptions have no major side effect, but sometimes your periods might get delayed, or sometimes you can have spotting, intermittent spotting, or sometimes your periods may come little early. So these menstrual irregularities can happen if you have taken an I-pill. If anything of this kind happens, then you should visit your gynecologist and seek her advice. So as the efficacy of these contraceptive pills is not 100%, so if a couple or if a female misses her period, then the pregnancy cannot be ruled out. Copper tea can also be used as an emergency contraception. If you've had one child and you're looking for a regular contraception and has had an unprotected intercourse, then copper tea can act both as your regular contraception as well as your emergency contraception if it is inserted within 5 days of an unprotected intercourse. So can it be used? How frequently can emergency contraception can be used? Ideally it should not be used very frequently, as it can derange your menstrual cycles. So if a couple has had an unprotected intercourse in a span of 5 days and they have ingested, they have taken one pill, then ideally it should be repeated after 5 days if they have again had an unprotected intercourse. The most important thing is that emergency contraception should not be used as a regular contraception because it deranges your menstrual cycle. So these are the important tips, important points about emergency contraception. I hope this video is useful to you, and if you have any queries or any questions regarding this, then you can kindly put your queries on the link given below.